Good morning, everyone. Carol here, and it's Thursday, the 21st of May. So I hope you're keeping well. Sorry that I haven't been in touch for a week or two. We have been planning, knee deep in planning for phase two of our response to the COVID-19 pandemic. It's important because it signals the end of phase one, really. And as you'll know, governments are working on the route map through the next period, and in particular to ease lockdown. And I wanted to just touch on this morning briefly one of the key strategies, in fact, the key strategy to help the county and the whole country to move through lockdown safely and progressively. And that is test, trace and protect. This is a strategy that is about finding the virus, quite aggressively testing for it, finding it in every corner. We know that it's invisible in many ways, but seeking it out and then taking steps to protect people and reduce the transmission of the virus to others. And we're in a good position to start that both in the county and in the country, because the R value, the transmission value of the virus at the moment, is below 1, and so that's really positive. So the key thing for me is that, of course, the case definition has changed. So the symptoms list was changed a few days ago. So we all know about the cough, new persistent cough, and we all know about the temperature. But the government added in the issue of loss of taste and smell. So that's important. And I think that's probably in recognition that the symptoms aren't always quite so straightforward, and that there have been people who've had the virus but haven't perhaps had the cough and the temperature so clearly. And that adds, I think, complexity to the need and the impetus for us to be testing far and wide now, as much as we possibly can. And testing in particular in what I'd call sort of the closed settings and the potentially more vulnerable settings. We've heard a lot about care homes, and we're actively stepping up testing and have been over the last few weeks. And we will be testing in every care home in Powys. And that's irrespective of whether it's a big care home, whether it has significant levels of symptoms and positive COVID patients or not. So that's really key, and I hope the more people will get involved, more practitioners will be involved in that testing process for us, because we need as much capacity on that as we can get. We're also likely to be testing much more in other closed settings, so our community hospitals, for example, but in other settings where there are a number of people coming together, and where perhaps the client, service user, resident, or patient are perhaps more susceptible, more vulnerable. The other element I just wanted to mention was sort of the general public, and in that we might start to see ourselves more key workers in terms of accessing testing. You can book in over the internet for a home test, and one gets delivered to you, or you can book into a community testing unit. So recognise things have been quite fast moving. It's sometimes quite hard to catch up with everything, but that is now available to everyone in Powys and in Wales. There's been a few teething problems, so tests have run out quite quickly during the first few days. So if you've got symptoms, you think you might have COVID, I'd suggest going on early, booking a test, and going from there really. And just to say that if you have a positive test, you'll start to get contacted by the contact tracing team that is being run by the local authority, and we're working really closely together as a team on that. And that test result that's positive will be followed by contact tracing, and that process is just up and running during this week as the first sort of test week really. So hopefully that information is quite helpful to you. A couple of other things to say, and we recognise that things are very different. Holidays are going to be a bit different this year, we think. But I just wanted to stress how important it is that we all try to take some rest and recuperation and an annual leave. So I know that we're gently encouraging people to take their leave. So if you haven't yet, please do plan to take your leave. I'm taking some leave early next week, and I'm looking forward to perhaps doing a bit more in the garden and that sort of thing. So whatever you are doing, please make sure you get a chance to rest and recuperate, and take care. And I'll be back in touch soon. Thanks very much, everyone. Bye now.